We move on to the next item, which is in the name of Deputy Sean Kenny, to the Minister for Health. Funding by the Health Service Executive's Mental Health and Disability Service to provide for residential placement for an autism sufferer. Deputy Sean Kenny has 4 minutes.
Thank you, Cathaoirleach, and I want to thank the Caincorla for selecting this issue, and I want to thank the Minister for coming in here. Before I start, I'd just like to pay tribute to Deputy Neville, who spoke just a few minutes ago, and pay tribute to his distinguished record in this House, particularly on the whole question of suicide. I'm like him. I am not going forward. I hope to get an opportunity later on when I speak on another bill to say my farewell speech. But for the moment, I want to raise this particular issue, which I'm raising in the Dáil today on behalf of a family in Donaghmede in my Dublin North East constituency, with their consent to refer to the details of their case. Their adult son, Igor, who is an autism sufferer, has been under the care of the HSE Mental Health and Disability Service for over 5 years, and since last year he has been an inpatient in the acute psychiatric unit at the Ashling Centre in the grounds of Beaumont Hospital. It has been acknowledged by the HSE Mental Health and Disability Services that Igor's needs would be better met by a placement in a residential care setting rather than an acute psychiatric unit, and his parents have been assured that the HSE are working proactively in progressing this solution. The problem which is causing anxiety to both Igor and his parents is the delay in providing the funding for the provision of a suitable residential placement. His parents have been informed on several occasions in recent months that a decision will be made very soon. Most recently, they were told that a decision will be made yesterday, but their hopes, which had been raised so many times before, were once again dashed. However, they sent me an email yesterday afternoon, which I will quote from, with their permission. We received a call from our social worker today to say NUA, that's the placement centre, can go ahead with referral, but meeting regarding funding is not for another 2 weeks when we were told it would be today or tomorrow. We were absolutely devastated over this and cannot understand how disability and mental health cannot meet to discuss our case. End of quote. They have also described to me, Cathaoirleach, the effect that the ongoing delays are having on Igor himself, and which is very apparent when they go to see him. This, Minister, is the reason I have sought to raise this matter here today, in order to attempt to try and get clarification as to why the decision on the funding keeps getting deferred in this case.
Cathaoirleach, as Deputy Kenny says, there'll be another time to maybe contribute in relation to the fact that he's not standing. I wouldn't say going away or retiring. I don't believe anyone ever retires entirely from politics. But I do wish to thank Deputy Kenny for raising this matter today, and I'm pleased to outline the position. Myself and Deputy Kenny have already had a discussion on this, and hopefully we will do more than what is in the formal reply. The modern mental health services, integrated with other areas of the wider health service, extends from promoting positive mental health and suicide prevention through to supporting those experiencing severe and disabling mental illness. It includes specialised secondary care services for children and adolescents, adults and older people, and those with an intellectual disability and a mental illness. The development of a mental health service is a priority for the Government. We have provided an additional 160 million ring-fenced funding over 2012 to 2016 to modernise mental health services in line with Vision for Change and the programme for Government commitments. This provided around 1,150 additional posts to enhance mental health and suicide prevention services generally. Of these, approximately 947 have been recruited up until the end of November 2015, and the remainder are at various stages of the recruitment process. The Ashling unit is a centre caring for patients with a range of mental illness. In view of the sensitivities involved, and I do understand that the parents of this young man have given the Deputy permission, but nevertheless, I don't propose to go into any great detail of the individual circumstances, but as I say, I've spoken in a private capacity to the Deputy, and he has filled me in on the young man's circumstances. However, I am informed that the person in question is under the care of a consultant psychiatrist and receiving a high level of nursing and multidisciplinary care. The multidisciplinary team involved will work actively to ensure that whatever supports are required are in place to enable this person to transfer to the most appropriate care setting when they are ready to be transferred or indeed discharged. I understand that North Dublin Mental Health Services are currently working with a provider, as the Deputy has outlined, with a view to assessing and accessing an appropriate residential care package to meet the person's future care needs. The HSE has assured me that it will keep this person's family updated on developments, as the Deputy has confirmed in relation to the communications that there has been with the family. As I say, it's quite difficult, Cathaoirleach, to go into any type of detail when you're talking about an individual case, but I have assured the Deputy that I will make further inquiries, and I'm sure that the resolution to this particular young man's difficulties will be dealt with shortly.
Thank you, Minister. And Doctor.
Thank you, Cathaoirleach, and I want to thank the Minister for her response. And I do accept that the Government has provided additional funding in this whole area during the term of this Government, and that additional posts have been created. Nevertheless, there still remains the question of this young man, Igor, and the fact that we haven't got his family have not got a definite timescale for to allow him to move out of the psychiatric unit into a more residential care placement setting. And I do accept that the Minister says that there's confidentiality around that issue. And I'm heartened by the fact that the Minister will make further inquiries in this matter. And I would hope that we would get that there will be some result fairly soon. Just on a more general level, Cathaoirleach, while I have the floor and while I have a minute left, there is the whole general question of the suitability of an acute psychiatric unit as a place to treat an autism sufferer. I do accept that it can be difficult to deal with a person who is an autism sufferer, but I just don't. And I'm, as a layperson without any medical qualifications, I don't see an acute psychiatric unit as really the best place for a person who has this autism. I would hope that maybe when policy has been formulated, that this matter might be addressed again. Thank you, Cathaoirleach.
Thank you, Deputy.
Well, just to deal with the general point, because I don't think it's appropriate to go into the details of this young man's case. Someone with autism or Asperger's or intellectual disability or an acquired brain injury or dementia or any of those things, that is no preventative for poor mental health. Sometimes someone that has autism can become acutely unwell mentally, or indeed Asperger's, they can become quite unwell mentally. It doesn't always sit side by side, but it does happen. And that's why we have to be very careful that we are clear about how we deal with people. Of course, if the only issue is autism, then that person should not be in an acute unit. But we don't know that. It could very well be that the person has difficulties with their mental health as well. And that's why this year, out of the 35 million that we've gotten in the budget, we will be developing a dual diagnosis service, which we didn't have up to this, and we still don't have, because we're in the process of developing it. Because up to this, if you had a difficulty with your mental health and you had a chronic alcohol problem, for instance, then the people in mental health could rightly say to you, it's only when you're dry that you can come to us, and the people who are dealing with the addiction would say, but that's a mental health problem. So the dual diagnosis piece is something we do have to develop, and it could very well be the case in this step. I'm not certain, but that is the case in some instances, why people who would have, I suppose, an overarching condition, but could equally have a mental health problem as well. But the dual diagnosis clinical pathway, I believe, should be able to deal with that.
Good morning, Sarah. Thank you. Could I also like to wish Deputy Kinney very best in his retirement. As a Galway person to another Galway person, I bring you good wishes from Galway, and we'll keep in touch.